Okay, welcome all to the Research Centre for Palliative Care Death and Dying fortnightly seminar series. Firstly, RePaD acknowledges the traditional custodians of the many ancestral lands and waters throughout Australia. We recognise the knowledge, strength and resilience of Aboriginal and Torres Strait Islander peoples and their continuing spiritual and cultural connection to land, water and community. RePaD pays respect to elders past, present and emerging. Hi all, my name is Sarah Thomas and I'm the Manager for the Research Centre. Today's presentation is by Caroline Litster. Caroline has been working on palliative care, death and dying projects for over 10 years. Her contributions have been varied and include research and project work for end-of-life essentials, end-of-life directions for aged care, care search and palliaged. Caroline is currently a PhD candidate within the College of Nursing and Health Sciences, supervised by Dr. Deirdre Morgan and Professor Sue Gordon. Today, Caroline's presentation will focus on what she intends to investigate as part of her PhD, titled Aging, Death and Dying at Home, Understanding the Role of Home Care Services at the End of Life. A friendly reminder that today's session is being recorded, and can all participants please mute their microphones during the presentation. Thank you very much.
Okay, so the topic of my PhD is what I'm proposing to look at anyway, is ageing and dying at home for older Australians. And I specifically want to look at the role of home care services at the end of life. And my supervisors are Dr. Deirdre Morgan and Professor Sue Gordon. And it's within the Research Centre for Palliative Care, Death and Dying. So I just thought I'd include a slide about me. So this is just one I found and I thought, oh, I'll just include this one of when I was in kindy. Yeah, I grew up in the country and a lot of my family is still living there. When I moved to Adelaide, went to university, did undergraduate in social sciences and honours, and then I ended up as an RA after some time working for Flinders Palliative and Supportive Services, which is now RePaD, and within the College of Nursing and Health Sciences. So my lens is non-clinical, and I think it's about 12 years I've been working as a research assistant. So passionate about palliative care, death and dying. And prior to starting my PhD, I worked for 2 years on a project called LDAC, and that sort of piqued my interest specifically in aged care. Okay, so this is just an overview of what I'm wanting to talk about today. So I'll give a bit of a background and then the problem, the gap, and I've got SOC here. This is a Tara Brabazon acronym for Significant Original Contribution to Knowledge. So then I've got my research aims, objectives and research questions, my research method and methodology, and a summary. Okay, so Australia's ageing population, we're experiencing a baby boom. So 30 years ago, the over 65-year-olds made up 11% of the population. And today it's 15% of our population, 1 in 7. So forecasts project that this will make up 18% in 2027, so 1 in 6, and by 2047, 1 in 5 Australians will be aged 65 and over. So the 85 plus population, there'll be an even greater need for aged care services for this group. We're living longer than ever before due to improved medical technologies, public health infrastructure, and better public health measures. And sorry, next one. So deaths in Australia. So death is an inevitable part of life, and 100% of us will die. So there's 169,301 deaths registered in Australia, and 66% were among people aged 75 or over. And this is the breakdown of males to females. So 59% for males and 73% for females. So where do people die? People die in a variety of care settings, including home or private dwelling, assisted living, residential aged care, nursing homes or care homes, or hospice. I'm just sharing this infographic that I found on Information is Beautiful website. So this is just, well, they gathered information on mortality data during the 20th century from around the world. And then they grouped each cause into general categories and branched off more specifically. So you can see that cardiovascular diseases, non-communicable diseases, and then you probably can't see because I can't share my slides properly, but they do branch off into other categories. So palliative care in Australia. In Australia and many other parts of the world, the demand for palliative care services is increasing due to the ageing of the population and increases in prevalence of cancer and other chronic diseases that accompany ageing. Palliative care is now provided in almost all settings where healthcare is provided. So hospitals, hospice, home and residential aged care. And it usually consists of medical, nursing and allied health. So that includes doctors, nurses, pharmacists, social workers, physiotherapists, occupational and speech therapists, psychologists and trained volunteers. And generally with advanced care expertise in advanced care planning, pain and symptom management, and loss, grief and bereavement. So key definitions, so palliative care, end-of-life care and terminal care. There's a lot of debate over these terms, and even though I've worked in this field for a while now, sometimes I still get confused over them. So palliative care is not limited to the terminal stage, and it is available for people living with any illness at any age and any stage of an illness. The goal of palliative care is to improve the quality of life of patients with active progressive diseases with little or no prospect of a cure. And yeah, there's other terms, palliative approach, and yeah. So the use of aged care services at the end of life, care for community dwelling people with end of life needs is available, but many people do not receive it. And the AIHW data shows us that many older Australians use aged care services in the last year of life. And that can be through home care packages, either paying for aged care services privately or through their informal carer. And I will be talking more about home care packages specifically. So the aged care system, when you start out at the beginning of your journey, the first step is the My Aged Care website. They also have a telephone number. So this is when a person would like to start the ball rolling and get access to services either in their home or if they go straight into residential aged care, depending on what the care needs are. And so community-based home care can consist of personal care or house cleaning, transport to medical appointments, shopping assistance and meal delivery, and respite services, day, overnight, emergency, and private care paid in full. So my area that I'm going to focus on is community-based care. This figure here, intensity and type of aged care, I'm specifically looking at complex community care, so people on home care packages under consumer-directed care. So consumer-directed care is just where it gives the recipient or the client choice in the care that they receive. So down the bottom, yeah, we've got my aged care. And you probably can't see where I'm indicating, but so when a person contacts my aged care, then they go through they get screened, and then they're assessed to see what they're eligible for, and that's an ACAT assessment. So then if they're assessed as eligible for home care packages, then they can receive a home care package at one of 4 levels, and these, depending on what your care needs are, you receive a different amount of money that you can then spend on services through a home care aged care provider. So a home care package provides services that can help someone to stay at home for as long as possible. It gives the recipient choice and flexibility in the way that care and support is provided. And as I just mentioned, you receive a formal assessment by an aged care assessment team. And here, yes, I've got the home care package levels and the percent, the number of recipients, percentage, and the total number. So this was 30th of June 2020. So again, this is the referral pathway through my aged care contact centre. So there is Commonwealth Home Support Program, CHSP, which is the entry-level basic care needs. And then home care packages is the more complex multiple care needs. And I've specifically picked, well, not included in my studies, CHSP, because it is just more basic level care. So key home care services available through a healthcare package. So when you get your funding allocated to you, the types of services you can pay for, or you can top them up by paying privately. Here is a list of some of the things that will be covered through your home care package. Domestic assistance, gardening, meals, shopping, social and recreation, transport, personal care, in-home respite care, home modifications, safety and security, health and wellbeing, equipment, devices and aids. So the Royal Commission announced in 2018 that they would conduct an investigation because there were concerns about abuse, neglect, premature death, inadequate practice of evidence-based care and suboptimal staffing ratios and skills. and inappropriate care models in the Australian aged care sector. So then the final report had 148 wide-ranging recommendations to reform the aged care system, and those that relate to home care, which in the future they'll call care at home. Within the new Aged Care Act, it will include words about palliative and end-of-life care, saying the right to fair, equitable and non-discriminatory access to palliative and end-of-life care for people, older people, needs to be provided. And people will be assigned a care manager. And, oh, God, sorry, let me just get rid of that. So the home care, there is, as a result of the Royal Commission, they found that there is a really long home care wait list, which the commissioners have said that that needs to be cleared, and expansion of the home care sector, including updates to My Aged Care, and just to make it easier to navigate and find specific providers based on the care needs that you have. So Palliative Care Australia's Palliate plan. So in response to the Aged Care Royal Commission final report, Palliative Care Australia has called for improved palliative care in aged care to ensure that it's core business in aged care. The 8-point plan was published in September 2020 and highlights the alignment between the Commission's recommendations and PCA's recommendations. So the future of aged care in Australia, the focus of residential aged care will be on high acuity, high dementia clients. More older people will be receiving care in their homes, and there'll be an increased emphasis on community-based aged care, and improvements to home care is therefore required. So my significant original contribution to knowledge. So I want to identify the critical elements of home care that facilitate end-of-life care, and identify the gaps in care needs and services delivered to older people approaching the end of life and receiving a home care package, or also those on the wait list for a package, and look at recommendations for home care service improvements. I apologise for the next slide. It's I know it goes against slide rules, but because the text is so tiny. So this slide is my research aims and objectives, and I'm not going to read all of them, but I have 4 aims. And the first aim 1 is to understand whether home care services meet the needs of community dwelling older people approaching the end of life. And approaching the end of life, I'm defining as the last 12 months. So aim 2 is to understand, describe home care provider views and experiences on home care and dying at home for older Australians by conducting a qualitative study involving semi-structured interviews. Aim 3 is to understand the perceptions of home care recipients and their informal carers, family members, on accessing and managing palliative care and end-of-life care in the home, and factors that contribute to an older person dying at home or not dying at home. And aim 4 is to identify in the existing Australian home care context the unmet and emerging needs to enable palliative end-of-life care and dying at home for recipients of home care packages. So the scope, I'm concerned with community aged care, not residential aged care facilities. Older adults are defined as 65 plus years of age living in private residences in the community. And so I'll be looking at consumer and provider views. So provider views will be study 2, consumer views study 3, qualitative, and another consumer study, which is study 4, quantitative survey. And I do want to collect information from people about the combination of care that they've received from informal carers, community palliative care, and obviously home care. And I was wanting to focus on packages 3 and 4 just because those packages indicate people that have more significant care needs. So my research questions, my overarching research question is, do home care packages help facilitate dying at home in older Australians with end-of-life care needs? And so my studies, the first one, systematic review, the specific research question, do home care services meet the needs of community dwelling older people approaching the end of life at home? Study 2, qualitative interviews with home care package providers. For home care package providers, what is needed and what enables quality end-of-life care delivered in the homes of older Australians? And the research question for studies 3 and studies 4, which is the qualitative interviews with the recipients, informal carers and family members, and then a quantitative survey of a wider selection of the same cohort, is what are the views and experiences of home care package recipients and their informal carers, family members on end-of-life care and dying at home. So my research methods, so I'm proposing to do a pragmatic exploratory mixed method study design consisting of 4 studies, and these will be completed sequentially. So the exploratory sequential design begins with collecting and analysing qualitative data, and these findings then inform the follow-up quantitative phase. And then integration through the merging of quantitative and qualitative data will be undertaken following that. So I'm taking a subjectivist inductive approach where I develop and refine the theory from the data, and the tentative framework and lens through which the collected data will be analysed and interpreted will be using Levesque's conceptual framework of access to healthcare. So Levesque's framework has been successfully used in research exploring, assessing and measuring access in various healthcare services and settings. It will help us to explore the extent to which older people approaching the end of life are getting access to the necessary services they need at home. And it will also help us analyse how barriers to accessing care are experienced across the dimensions of approachability, acceptability, availability, affordability, and appropriateness. So I'm not actually going into details of the individual studies. Rather, I would like to sort of open some discussion about, to get some feedback from people on what they think I could do to better achieve my aims and objectives. So I've got a list of a few things I thought that I wouldn't mind getting some feedback on. So others suggested models, theories, theoretical frameworks and approaches. So I didn't go into the recruitment approaches that I'll be using, but in a nutshell, study 2, I intended to email home care services through a publicly available list that you can download from the AIHW website. And then I've already had a look at that list, and you can filter. It's like an Excel spreadsheet that you can filter then by home care providers or multi providers that offer both residential and home care, but they need to have the home care places to be eligible to recruit through. And then my plan was to ask those home care services after that interview study to then send their invitation on to their client list. And I haven't asked him, and he's probably here, but I did have a thought of maybe sending to try and get a cohort of people that are at the end of life, potentially see if I can send it through via SAPs onto potential participants via an information sheet. And then study 4, which is a wider scope, and it's a survey across Australia wide. And then I thought I would put advertisements in newsletters and social media. So that was the plan for the recruitment. So for study 4, which is the online survey, at the moment, the survey is looking at consumers' perspectives. So it's an extension of study 3. And I wondered, it has been a thought whether I potentially extend it to the scope to include home care providers using branch logic within the survey. So have it as an extension of both study 2 and study 3. So this is something that I've sort of struggled with a fair bit, because the program of research that I'm proposing focuses primarily on enhancing home care supports and services for older Australians receiving a home care package. But I haven't looked at self-funded retirees. I am aware that probably some people may be self-funding, because I am including people that, I intend to include people that are waiting for a package. So therefore they are self-funded, and I want to find out what services they're accessing while they're waiting, and what's happening to those people. So I suppose I am in a way, but that's not the focus of my PhD. And at the moment, I've got it at the individual and provider level, or consumer and provider level. I haven't really included key stakeholders at the system level, but I can include that to study 2. So I wanted to thank some people. So my supervisors for putting up with me, Deirdre and Sue and Di, and Deb, who's my assessor, Jen, who's a centre director and who has employed me for a long time, and everyone at FMC, the research crew there in the RePaD section. We've got a really good group there. So also, I always say to Rachel, Damerel and Sue Hammond that librarians are gods. So I like to use the information specialists, knowledge architects, and I actually found a new one, which is databrarians, which I'm not sure if I've heard of before. And then some other people that have helped me so far. Tara Brabazon and her blogs. Everybody knows I love those. and I love Hugh Kearns's work. I can identify with everything he says all the time. So these are my references that I've used. So I wanted to open it up to the floor for any questions, comments, or suggestions. I have made it shorter because for the purposes of the confirmation of candidature, I need to have a shorter time frame for the presentation with longer questions, I believe. So yes, if I can open that up, Sarah, do you
Yep.
want to?
Okay. Thank you. That was fantastic, Caroline. Wrap this up quickly, if that's okay. Again, thank you so much for presenting. I hope everyone enjoyed the conversation. This is our last session for 2021. We've had a fantastic year, and I remind you all that the seminar series presentations are available on the Centre website. You will shortly receive an email with a link for a survey on the seminar session, and we would really appreciate any feedback on this program. The 2020-2022 program will be finalised once an evaluation of the survey has been completed. I would also like to take this opportunity to thank Selena Shu. Selena has been working with the Centre this year and has done a wonderful job with the seminar series. Selena will be moving on from the Centre in the next few weeks, and I would like to wish her the best of luck in her new role and her move to Sydney. Is there anything else you want to add, Jen, before we end? No? Okay. I'm going to end the session, wishing you all a peaceful and enjoyable festival season, and I will see you in 2022. Thank you.